welcome everyone to today's Kahoot-based radiology quiz. So this is your Kahoot pin. So open your mobile devices and go to this website, kahoot.it, and input this pin. So the pin is 9403515. I'll just add that website in the chat if somebody wants to use that. We'll wait for a couple of minutes for everybody to join in. If there are issues with my audio or video, please let me know and I'll try to sort it out. So today there's a small twist. So we are allowing users, instead of using their own names, we are using random names just to make it fun and interactive. So once you go to this website and input this pin, you can join the quiz and choose your preferred username. That's the pin. Amar has shared it in the chat. So to participate in the quiz, you need to log in to the Kahoot website. You can't participate while you're watching it on YouTube or Facebook. Sure, I will reduce the Kahoot volume a bit and hopefully it's better now. So if hopefully I'm audible now. So for everyone who wishes to participate in the quiz, you need to go to this website. Let me type it in the chat. Website. And the pin, as Amaya has shared already, it's 9403515. Okay, so we have around 23 people. We'll wait for just one more minute just to make sure that, say, in case somebody joins in late, we don't want to be unfair on them. So we'll wait for a minute and we'll start at 10:45 sharp. In the meanwhile, thank you everyone for subscribing to the Radiogyan YouTube channel. We just hit 10,000 subscribers, and a part of to celebrate that, we are giving away 5 subscriptions to the Radiogyan case collection. How can you win that? So you need to participate in the quiz. That's the first part. And the second part is you have to subscribe to the Radiogyan YouTube channel. So if you aren't subscribed yet, now is the time. Make sure you subscribe to the channel. Let me bump up the volume a bit. Okay. So hopefully it's audible now. So make sure you subscribe to the channel. And now, while you're in the Kahoot window, make sure you take a screenshot of your mobile device or whatever device you're online on. So once you, so that'll help you claim the prize. So 2 steps: you need to subscribe to the YouTube channel and you need to participate in the quiz. So we have around 32 people and we'll start the quiz. So how this works is these will be MCQ based questions. You'll get an image and 4 choices. The image will be shown on the YouTube screen and will also appear like a smaller version of that will also appear in your mobile devices. You have to choose the most correct option. So we have a couple of trial questions. So those questions do not carry any points. So that will help you understand how this exactly works. So if you have any questions, you can ask in the chat and I'll keep a lookout in the chat. And we also have Dr. Amar Kulkarni, who is helping us with the chat today. He's part of our team. So thank you, Amar, for signing in today. Okay, so let's start our Kahoot radiology quiz. So that's our first question. What is this investigation called? So is it called a CAT scan? Okay, let me just get the options in. Okay, so this is better. So each question has slightly different timeline. So if it's a difficult question which may need time, so I have kept a minute for that. For the other questions, I've kept around 30 seconds or 20 seconds for it. So 26 of you got it right. Anyways, this is a trial question just to help you understand how this works. Another trial question, you'll get a leaderboard after every quiz because this didn't have any points. So that was that. Okay. So when you get a study and you have no idea what to do next, you don't know, you have no clue what's happening in the study, what would you do next? So these are options. You suggest a short-term follow-up. You advise clinical correlation, as all of us radiologists do in most cases. Or would you? So all of the above is the correct answer, and let's get this thing started. Hopefully now you're well acquainted with how this works, and the questions from now on will have points, so make sure that you participate. Again, how this works is that faster you answer the question, you more the points you get. So, for example, if a question has 1,000 points, if you answered it within, say, the first 5 or 10 seconds, you'll get the correct answer. You'll get more points versus somebody who answers in the last few seconds. Just let me have a look at the chat in case there is anything going on. If there are issues with the chat. Okay. So for those who have not participating on like Kahoot, you can also type in your answers in on the YouTube chat. It's fine. The goal of this session is to learn. So it doesn't matter if you don't participate in the quiz. Preferably you should, because that's the fun part of it. But even if you don't, that's perfectly fine. Okay, moving on to the actual questions now. So this is the first question for today's Kahoot quiz. So which of the following can give this appearance on chest radiograph? So this is a frontal chest radiograph. As you see in the upper right corner, it's a portable chest radiograph. So this is an acute ICU type chest radiograph. Which of the following can give rise to this appearance? So the appearance here is the typical bat wing perihilar type of distribution. This can be seen, the most common and the typical cause of this is cardiogenic pulmonary edema, but it can also be seen in pneumocystis cerevisiae pneumonia, and a few cases have also been described in aspiration pneumonitis, although not very typical. So all of these can give rise to this appearance, although if the question was what is the most likely diagnosis, then cardiogenic pulmonary edema would have been correct. So here the answer is all of the above. So the pattern here was bat wing type of appearance. Next question here. So identify this structure marked by the arrow. A clue towards the diagnosis is that this has been stable for, say, many years. This is an axial post-contrast CT at the level of, say, the diaphragm or the gastroesophageal junction. So what do you think is abnormal here? Is it abnormal or is it normal? And what this structure pointed by the arrow is? Is it cisterna chyli? Is it a necrotic paraesophageal node? Is it celiac ganglion? Or is it an esophageal diverticulum? So excellent. So 23 of you have got this one correct. We can go over the image once again. What we see here is a well-defined hypotense structure which is closely related to the aorta. Although a necrotic paraesophageal node can have a similar appearance when it's completely necrotic, but because it's been stable for a long period of time, this is more likely to be a normal variant. That's the cisterna chyli. That is the lymphatic sac, which is located at this location. It's commonly mistaken for a necrotic node. So make sure that you have priors and compare to those. Another normal structure which can be seen in this region, albeit slightly more inferiorly, is what is the celiac ganglion. So it'll be slightly more denser than a lymphatic than the cisterna chyli, but that is also a normal variant which can be seen in this region. So 23 of you have got this one correct. And at the end of two questions, a rapid otter is on the leaderboard with 1,768 points. So the question here is, what would be the most likely diagnosis for this case? So the question is most likely diagnosis. Are these, say, pulmonary and hepatic mets from an unknown primary? Is it cholangiocarcinoma with lung mets? Is this liver abscess with septic emboli? Or is it multicentric, minimally invasive adenocarcinoma of the lung? So let's go over the image. On the actual CT at the level of the upper abdomen, we see this hypodense lesion predominantly involving the left lobe with these ragged kind of margins. There is some edema around the lesion. This was at the lung basis, so we picked up this at the lung basis. We see this consolidations, multifocal consolidations with few central areas of say cavitation or breakdown in its central portion. So this differential that you usually gave the liver abscess, cystic emboli, and that's what we found out. Let's look at the other outcomes. One of the other was increase the event sets from an unknown primary. This is now usually kind of right source of the ground. And let's considering the memory primary. Those are habitually usually events are solid down also. Even in the liver, the appearance of metastasis would be that of a target lesion where there will be peripheral slightly less hypodense area and the central more hypodense area. So again, that would be slightly lower down. The next option was cholangiocarcinoma. Again, that would be a good differential, but okay. Are there any issues with my audio? Somebody just mentioned that there is no audio. Can you please let me know in the chat if my voice is audible? Uh, if you can let me know in the YouTube, Amaya, if you are in the YouTube chat, can you please let me know if my voice is audible? Okay, few people mentioned that there was an audio problem. Uh, okay, sounds okay now. So I don't know what was causing it. Okay, is it better now? Okay, was it okay? Okay, hopefully it's better now. So apologies for that. I don't know what at what point did we have those audio issues. Okay, thank you for letting me know, and hopefully the audio like it's better from now. Let's move on to the next question. Okay, so is the splenic enhancement normal or abnormal in this case? There are two options that it was not allowing me to keep two options. So make sure you don't choose those options where I've mentioned do not choose. So is this splenic enhancement normal, or do we need to do something about this? Excellent. So all 36 of you have got it right. So the splenic enhancement is perfectly normal in this case. Does anybody know what this appearance of the spleen is known as? Let me know in the chat section what this appearance is known as before we move on to the next case. So this typical world kind of enhancement involving the spleen in the early arterial phase is normal, and there are multiple names which have been given to this splenic appearance, but irrespective of what you call it, this is the normal splenic enhancement. So zebra spleen, Moyer spleen, psychedelic spleen, so all these are alternative names of the same splenic appearance, but any of these cases, this is a normal appearance of the spleen. So good that all of you who are attempting this got this correct. So Moyer spleen, psychedelic dose. So Jishan, Divyani, Diane. So all of you have got it correct. Yeah, Stuti, even this is also known as tigroid pattern. So that was a trick question. This is the normal appearance of the spleen. And remember that this appearance you'll see in the late arterial or arterial phases of the study. Often if you do MRs or CTs for pancreatic staging or evaluation of liver tumors, you'll commonly see this kind of appearance of the spleen. So that's perfectly normal. Okay, so I think this is question number 5. Which of the following is not true regarding this pathology? So this question has 1 minute, so make sure you look at it carefully, try to identify the pathology, and then go over the options. As Amir has rightly mentioned in the chat, this appearance of the spleen is due to different flow rates in the white and say red pulp of the spleen. The reason that I shared the previous case was many times I've shared a spotter case and people have pointed out, oh, the splenic enhancement is abnormal. So just to make sure and drive home that point that this is normal enhancement of the spleen. Make sure that you attempt all the questions irrespective of wherever you stand in the points tally, because the last few questions have double points. So you never know, you may end up at the top of the table. Okay, so what we see here is circumferential thickening involving the left pleural, half of the left pleura, and there is say volume loss. There are a few calcifications involving the pleura on either side, and there is a mild ipsilateral shift of the mediastinum. So the diagnosis in this case is mesothelioma, as most of you must have figured it out either from the case or from the options. And the correct answer is associated with smoking. So as mesothelioma is one of the few pathologies that has not been shown to be associated with smoking. It's definitely associated with long-term asbestos exposure. It's characterized by nodular circumferential pleural thickening and is associated with ipsilateral mediastinal shift. So good that 21 of you have got it right. So at the end of, I think, 5 questions, Blue Bobcat is on top of the table, but the competition is really close. There's only 4 or 500 points separating the first person from the last. So anybody can win here. So make sure that you attempt all questions. Moving on to the next question. So this patient presented with acute pain. They were participating, I think they were playing cricket, and then they complained of sudden acute pain in the calf. So what would be their diagnosis here? Is it tennis leg? Is it cricket leg? Is it swimmer's calf? Or is it golfer's calf? So this is a longitudinal, say, panoramic ultrasound at the level of the calf. The superficial muscle here is the gastrocnemius. Unfortunately, my mouse pointer is not showing up, but the superficial muscle here is the gastroc. The more deeper portion is the soleus. And we see this fluid cleft separating these two muscles. And this is a very typical appearance for what is known as tennis leg. So tennis leg classically has been described as a tear of the plantaris tendon, but more often this has now been associated with tear of the medial head of the myotendinous junction of the medial head of gastrocnemius. So that's a very typical appearance. And make sure in these patients, usually these patients will present for a DVT ultrasound or vice versa. So make sure that if you see this pathology, you look for DVT, because 10% of these patients are known to have associated DVT, which can be incidental. So this was a case of tennis leg. The other options I just made up. I don't think these are actual pathologies. And 16 of you have got this one correct. So that was a nice case of tennis leg on ultrasound. We have made a detailed video on that, so you can check that later on our YouTube channel. Moving on to the next question. This is a abdominal, say a KUB radiograph. Okay, so as Amir rightly reinforced that, make sure that you scan the area of interest apart from DVT. In fact, that patient presented for a DVT study, and the sonographer incidentally picked it up. And good that they showed us, because then we were able to make that diagnosis. So make sure you scan the actual area of pain when patients present with DVT, because many a times there can be incidental findings that are cause for the patient's pain. There may be something like a popliteal artery pathology, say a synovial sarcoma in that region. So make sure that along with the DVT, you cover all this. Coming on to this abdominal radiograph. So what do you think is abnormal? So okay, we have a mixed kind of response here. So right kidney, somebody has said right, 14 of you have said right kidney and 14 of you have said bladder. For those attempting these in the chat, what do you think is the pathology? What's happening here? So I don't know. So the kidney shadows appear fine. What we see is bilateral nephrostomy tubes. The reason that I kept that portion of the study is just to give you an idea that there's something going wrong with the kidneys. Now let's look on in the region of the bladder. What we see here is this mottled kind of appearance in the region of the midline pelvis. So what could that be in a patient who has, say, bilateral nephrostomy tube? So say there's something going on, there's some geopathology going on. So a mottled appearance in the midline pelvis, what can you think of? So let me know in the chat. So excellent. So look at the stoma as well. So I think one of you has got it right. So this mottled kind of appearance in the region of the midline pelvis is very typical for emphysematous cystitis. Make sure in this patient we had these bilateral nephrostomy tubes, so that does give us some clue about the pathologies, but this may not be very obvious in other routine cases. So make sure that apart from the kidney areas, which we always look on studies, make sure you definitely look at these areas, look in the midline pelvis as well to see if there is a small bladder calculus, a lower ureteric calculus, or in say rare cases, signs of emphysematous cholecystitis. Excellent. So Nancy and Sikon's case, apologies if I'm pronouncing your name wrong, have correctly pointed out this in the chat. So this was a case of emphysematous cystitis. Okay, so last few questions. So where is this foreign body? This is a frontal radiograph. You will commonly get this, especially in the pediatric population. Again, there are two options that you should not be choosing. There are only two options to choose from. So is it in the esophagus or is it in the trachea? In most cases, you'll definitely get a lateral view as well, in which it'll be very obvious. But on the frontal view, you may get a case in your exam where they provide you only the frontal view. So 29 of you have got it correct. So this foreign body is definitely in the esophagus. Remember this configuration. The way I remember, like to keep it very simple, is look on the frontal radiograph. If it looks like an O, it's in the esophagus. So O for esophagus. This is because of the configuration of the esophagus. So the trachea has a more, is wider in the anteroposterior dimension because it's made of cartilage. It's kind of a taut structure. Esophagus, on the other hand, is say flattened in the anterior posterior direction. So that's how a foreign body which is lodged in the esophagus gives this kind of say appearance on the frontal chest radiograph. A lateral radiograph would definitely be like they'll confirm the diagnosis, but if you just have one single radiograph, that's how you distinguish a foreign body in the esophagus versus trachea. Does anybody know what this foreign body is? That's also a very commonly asked question. So what is the most common, say one of the most common foreign bodies that we see in the esophagus or trachea in the pediatric patients? In the lung, I think groundnuts and peanuts and any forms of nuts they get lodged very commonly in the bronchi. But these ones in the esophagus and trachea, so button batteries, so that's excellent. So Anil, Renard, Zelda. So coin is a good thought, but coin would be say will be homogeneous because a coin the metal would be homogeneous throughout. A coin would be homogeneous. So if you look at this Naitik, there is a thin rim which is hypodense, not hypodense, but say less opaque as compared to the rest of the foreign body. So this is a button battery, as both of you have pointed out. Okay, moving on to the last couple of questions. These questions have double the points. So make sure you give enough time. And if you have not done yet, make sure you screenshot your Kahoot. So just so that we know that you can claim your prize. How do you claim your prize? So take a screenshot and just send it to me on my email ID, which is admin@radiogyan.com. I'll mention that in the description section, and then you can claim your prize. 5 candidates will get free subscriptions to Radiogyan's case collection. So everybody is still in the race. Make sure you attempt all questions. So as I said, these are double point question. What is the most likely diagnosis? These are a couple of good points that Amar has mentioned in the chat. Button batteries and coins both are common, and you can also see these say in elderlies with who use hearing aids. In fact, the patient that I showed was not a pediatric patient. It was an adult patient with psychiatric issues, and she had multiple suicide attempts, and this was like one of her attempts where she tried to swallow a button battery. She tried to swallow a bunch of things. This was one of that. So here is a T1 and water sensitive coronal MR image at the level of the pelvis. There is a large mass on the left half of the say pelvic girdle. It's the signal here is what I want you to concentrate on. So it has a very dark signal on T1 and water sensitive sequences. So what could this be? Although all these options definitely can have this appearance, but the correct answer here is fibromatosis. So fibromatosis has this very typical infiltrative kind of appearance, which is T1 and T2 hypointense. Very few pathologies are hypointense both on T1 and T2. So if you remember, fibromatosis is one of them. Let's look at the other options. Aggressive soft tissue sarcoma, definitely a good thought, but you see that there is no T2 intermediate or T2 hyperintense component. So, aggressive soft tissue sarcomas will usually have some T2 hyperintense component. Extraosseous osteosarcoma is again a good thought, but even that will have some amount of soft tissue component. So this amount of, say if you're trying to say this entire thing is calcified, that would be very rare. So extraosseous osteosarcoma would be again lower down. Capnon, I just put in there just to confuse you. So capnon is a calcifying tumor which can have a similar appearance on T1 and T2 water sensitive sequences because of its calcium content. But remember that that is a tumor of the central nervous system. So you'll not see that peripherally. You'll either see that in the region of the spinal cord or in the brain. So that was just there to confuse you. So this was a case of fibromatosis. And these patients, these tumors are they are fairly aggressive in the sense that they are known to recur very commonly, and they're very difficult to treat as such because it's difficult to get those clean margins. So these patients usually are followed up. So this patient was being followed up for, I think, more than 5 years, and it had been stable. So excellent, 19 of you have got it correct. Let's move on to the last question for today. And before that, Honest Deer is the one who's at top, but because the last question has double the points, anybody can win here. So which of the following is not a cause of this pathology? This is a coronal CT, and you have 30 seconds to answer. So the options may give you a clue about what am I talking about. So even if you're not able to identify the pathology, I'm sure the options will give away the answer. So which of the following, remember, is not a cause of this pathology? Excellent. So 23 of you have said, no, sorry, only 7 of you have got it correct. So all of you fell for the trick that I had put in. So can anybody mention in the chat why IV drug abuse is the correct answer? So the finding here, in the meanwhile, I'll describe this. So this is the coronal CT at the level of the sinuses and the orbit. The diagnosis here is a perforated nasal septum. So if you see in the midline, the nasal septum is perforated. The common pathologies that can cause this are trauma, infection, inflammatory pathologies such as granulomatosis with polyangiitis, which is previously known as Wegener's, and cocaine abuse, but that's usually inhalational cocaine abuse. IV drug abuse will not cause perforated nasal septum because it's because of the local effects of the way these people take those drugs and not because of IV drug abuse. So that was a trick question. And let's see our leaderboard at the end of the quiz. Thank you everybody for participating. And if you're not yet subscribed to the YouTube channel, make sure you subscribe and turn on notifications so that next time we go live, you are notified. And let's move on to the leaderboard. So that's the podium for today. With 7,500 points, we got 10 out of 12 question. Honest Dear was number 3. Legend Gator got 9 out of 12 and is on number 2. And number 1 is Blue Bobcat. And make sure you let me know by email and take a screenshot. But there is a twist here. Let's go on to see how many people participated. So 5 of, you'll get a feedback for, so let me click on this. So if you can give a feedback for the quiz in your Kahoot app, that would be great. So let me know how the quiz was. Was it easy? Was it difficult? And you can also let me know that in the chat. For those who are viewing it later, please let me know in the chat how we can do these better. So I'll wait for a couple of minutes for feedback. Okay, so Zelda, for the previous question, you have rightly pointed out that nasal drug, so inhalational drug use can cause that. Okay, let's show the feedback. So excellent. So we've got a few feedbacks already. So thank you everyone for the feedbacks. And the twist here is, I don't know if you guys read carefully, I had mentioned that the 5 deserving candidates will get the free subscription. I congratulate the winners, but the people who are going to get the subscriptions are the ones who are at the bottom of the table, but have attempted all questions. The top of the table, you're really good. I don't think it'll help you as much as it'll help the ones who are at the bottom of the table. So let's look at the players who are at the bottom of the table. So make sure, so the criteria is you have to answer all questions, and we look at the bottom of the table. Who's, so let's look at this. So let's sort by the final score. And so the ones which are 0, I would not count them because I don't think, so those are the unanswered one. Let's see if you have, if we have people who have not answered. So Friendly Duck is one of the winners because you have answered all the questions and you're bottom of the table. Let's move on to the next one. So Friendly Duck, you are one of the winners. The next one is Giving Bison, Agile Gecko, and Agile Gecko, Noble Snail, and Winged Hawk. So let me just get this correct. So Friendly Duck, Giving Bison, Agile Gecko, Noble Snail, and Winged Hawk. 5 of you get free subscriptions to the Radiology Quiz collection. Make sure you take a screenshot of your quiz and send me by email, and I will let you know how can you get that subscription. So congratulations to the winners. I know you guys, these people deserve getting that more than you guys. And If you have any questions or feedback, please let me know via email or in the comment sections. Thank you, everybody, for joining us for this Kahoot based quiz. And we shall see you in our next Saturday live session. Thank you, everyone. Thank you, Amar, for helping with the chat. Bye bye.